Hi, we are the science innovators from
SMJKI.
The coronavirus-19 pandemic has created serious challenge to global health. Mask has been recommended as a potential tool to tackle the COVID-19 pandemic since the initial outbreak in China. Evidence exists that the use of face masks prevents contracting and transmitting COVID-19. Surgical face masks and N95 face masks are effective, but cloth face mask has been recommended for use by the general public in order to preserve the supply of surgical or N95 masks for medical personnel. Wearing surgical masks in public could help slow COVID-19 pandemic advance. Masks may limit the spread of disease including influenza, rhinovirus, and coronavirus. There are many different types of face masks and respirators offering different levels of protection to users. Surgical masks, N95 respirators, and KN95 respirators, they all serve the general purpose of providing some form of protection against contaminants in the air. The filtering capacity enhances the level of protection against pollutants and pathogens. Depends on the materials used and the engineering design. Type 15 N95 respirator has filtering capacity superior to surgical masks. They have lower breathability and may cause discomfort after hours of wearing. The surge in demand for surgical masks and respirators has led to a global shortage of supply and raw materials. As a result, many people have resorted to making their own masks. Recycling used masks or settling for masks offering less protection than actually needed. Researchers and industry players have therefore been working hard to address the issue of shortage, as well as to enhance the protection afforded by existing mask models. The issue of mask shortage, methods to decontaminate used masks were introduced and elaborated. The review then discussed research advances in the development of materials with improved filtering capacity and antimicrobial activity. The measure to prolong life of disposable masks and the invention of reusable masks should be encouraged. In order to live with emerging infection disease and seasonal influenza epidemics, every individual should have personalized reusable masks, gown, and gloves made of self-disinfecting fabrics, and even reusable and default face shield within their own set. We should provide community members with well-researched practical guidelines on suitable fabrics and design for the most protective do-it-yourself masks. Basic principles around fabric filtration and water resistance, mask fit, number of layers, changing of masks, and washing can inform such guidelines. Significances of our project are: people do not alert with environmental pollution due to numerous uses of face masks. Secondly, people always feeling uncomfortable after wearing face masks for a long time. Thirdly, people need to spend extra cost for buying the face mask. Last but not least, no other uses of face masks aside from preventing droplet spray. There are several objectives of our project, which are to provide the environmental friendly face mask, to provide the enjoyment to have the smell in their face mask, to provide the opportunity to make their own face mask, and to provide easy and cheap ways to produce face masks.
There are pictures of medical professionals from the early modern age treating patients suffering from the bubonic plague wearing big light masks. These masks were supposedly filled with herbs such as clove or cinnamon, as well as liquids, and lead to the term big doctors. In 1897, the hygienist Carl published his work on the development of droplet infections as part of his research on the genesis of tuberculosis. MYCYS described a one-layer mask made of gauze. MYCYS assistant Hubner resumed the topic and described a two-layer mouth protection made of gauze that should prevent droplet spread. More studies regarding the germs contained in the operating room air followed. Until 1910, the application of face cover was not common in surgery and the general hospitals. Nevertheless, An earlier illustration of a multi-layer face mask made of gauze can be found in the surgical operating teachings of the British surgeon. The surgical mask was used first in the operating room of Germany and the USA in the 1920s, especially in endoscopy procedure or small surgery. The mask was renowned for a long time. Beginning in the mid-1960s, the use of disposable items made of paper and fleece was introduced all over the world after this was started in the USA. Following the recommendations of the RKI, the available data indicate that surgical face masks lower the contamination of indoor air. During the COVID-19 pandemic, the use of face masks seems to be an accepted procedure worldwide, although a scientific discussion is going on up to now, which has its root in the history of medicine and science. From the statistical data, we found that 5,500 metric tons of face masks were produced within 3 months. Secondly, the duration of face mask decomposition is 450 years. We also found that there are 15.6 billion face masks that have polluted the sea. We have prepared 3 flavors, which is orange flavors, pandan flavors, and mint flavors.
Users can enjoy the flavor or smell. The flavor provided are good for breathing system. No artificial elements mixed. Users also can try to produce their own. Manual preparation will be given. The added value to our face mask compared to others. Our face masks have various flavors or smells which are good for respiratory system. It is also environmentally friendly, which is using green technology to produce. Besides, it is easy to be decomposed. Our mask is environmentally friendly, which is using green technology. It is easy to be prepared that everyone else can also prepare it. Our mask prevent from transmissions of diseases. It is also cheap and naturally prepared, so there is no harm. For the future recommendation, we will provide an environmentally friendly mask. We will prevent droplet spread and transmissions of diseases. Besides, we will provide smell which benefited to our breathing system. We will also reduce enormous plastic waste. Our budget is 0. This is the total amount used of face masks every single day based on our research. With the amount, we can see that face masks have high request and demand in the public. Plus, face masks can be used in any circumstances, such as haze, having flu or fever, and as a fashion. Our face masks have high potential to be well-known product as a lot of famous public figures also wearing face masks in public. The request will increase continuously since face masks are useful in many ways. Our face mask has various flavors. You can wear a more comfortable mask and save money and also the environment at the same time. Although our mask having all these benefits, it just costs 30 cents per mask. Our face mask originated from waste and inserted flavor.